I'm Yvonne Commodore-Mensah, Associate Professor at Johns Hopkins School of Nursing and Public Health with expertise in hypertension research.
My name is Valy Fontil. I am a practicing primary care physician, health services researcher, and implementation scientist at UCSF.
Dr. Fontil, can you share with us what are some of the challenges with home blood pressure monitoring that you've observed in your clinical practice?
Just giving patients a blood pressure cuff and tell them to take measurements at home is simply not enough. We've seen in multiples of QY initiatives and multiple interventions and trials that home blood pressure and monitoring programs require a level of support in order for them to be effective. And it makes perfect sense when you think about the processes of care in managing hypertension, when you think about encounter frequency, treatment intensification, and medication adherence. Without integrating home blood pressure monitoring and clinical support within a clinical workflow for these processes, it makes sense that it wouldn't help very much. If somebody measures their blood pressure at home, the first thing that needs to happen is that those blood pressure measurements have to be communicated back to the clinician. And then those numbers need to be processed in order to assess whether the blood pressure is high or not. If they're just a lot of random numbers, clinician who's receiving them still has to either do the average of them or some other form of synthesis to determine that this blood pressure is elevated and requires treatment. Therefore, any program that's going to be sustainable is going to require some workflow integration, so operated and executed by human beings or automated with the help of clinical decision support. To the topic of home blood pressure monitoring to advance equity or to address inequity, I like to separate it at multiple levels. So the first thing, to address equity, the home blood pressure monitoring program needs to actually work.